Today we're going to talk about a medication with a story that is honestly pretty dramatic. It's a drug that went from being a total blockbuster to practically forgotten, and yet it's still an absolute lifesaver for a very specific group of people. So, let's get into it.
And that really gets to the heart of what we're looking at today. I mean, how can a drug that feels like it's from another era, that seems totally obsolete, not only stick around, but actually be the #1 best choice in a critical situation? We're going to find the answer in the incredible story of Methyldopa.
Okay, so to really get why it's so important now, we actually have to take a trip back in time. We need to see the rise and the fall of this once superstar drug.
So, picture this. It's the 1960s, and this drug is discovered kind of by accident, but it works so well that by the 70s, it's the go-to, first-line treatment for high blood pressure. It was a huge deal. But then, the 80s and 90s happened. A whole new wave of drugs came along. You've probably heard of them, things like beta blockers and ACE inhibitors. For most people, they just had fewer annoying side effects, and just like that, Methyldopa got pushed out of the spotlight. So why did it get pushed aside? Well, funnily enough, the reason it fell out of favor is the exact same reason it's so fascinating. It has this really unique way of working. It doesn't target the blood vessels directly. Nope, it pulls off a really clever trick inside the brain.
So first up, you gotta know that Methyldopa is what we call a prodrug. That basically means the pill you swallow, it's inactive. It doesn't do anything, yet. Your body has to work some magic on it first, converting it into the active substance that actually gets the job done.
And this is where it gets really cool. The drug is able to sneak into the brain because it looks like a natural amino acid, so it kind of gets a VIP pass right through the super tight security of the blood-brain barrier. Once it's inside, the body converts it not once, but twice, until it becomes something called alpha-methylnorepinephrine. And here's the trick. This final form is an imposter. It acts like a false neurotransmitter that your own brain cells start using.
So what's the bottom line here? The brain's main control center sees this imposter signal and thinks, whoa, okay, we've got plenty of fight or flight signal already. So in response, it just dials the whole system down. Your blood vessels relax, your heart rate might slow a bit, and your blood pressure drops. It's a really smart, indirect way to get the job done.
But here's the twist. That same action in the brain, well, that's what causes the side effects that made it unpopular for most people. But that is not the end of the story. Not even close. This is where we get to Methyldopa's modern-day redemption story, where it plays a role that is absolutely irreplaceable.
And here's the big reveal. Despite being an old drug, Methyldopa is the #1 first-line drug for managing high blood pressure in pregnant women. I want to be super clear here. This isn't a backup plan. It's not the second best option. It is the go-to gold standard treatment.
So you're probably asking why. For this one specific case, why this old drug? The answer is simple. Safety. We have decades of data. We're talking mountains of information from its use over the years. We know it doesn't cause birth defects. We have long-term studies on kids who are exposed in the womb, and they're fine. It has this proven, solid track record that the newer drugs just can't compete with.
Okay, so this all leads to a pretty obvious question, right? If it's so incredibly safe and effective for this critical use, why did it fall out of favor for literally everyone else? Well, let's take a look at the drug's downsides.
You can pretty much split its side effects into two camps. On one side, you've got the more common stuff, mostly tied to that brain activity. You know, feeling sleepy, drowsy, having a dry mouth. Annoying for sure, but often manageable. But then, on the other side, you have the rare, but way more serious risks. Things like liver injury and a really strange autoimmune reaction. Let's talk about that autoimmune risk for a second, because it's really unique. So get this. Up to 1 in 5 people taking it will get a positive result on a lab test called a Coombs test. Now that test just looks for antibodies on your red blood cells. But, and this is a huge but, just because the test is positive doesn't mean you're in trouble. In fact, only a tiny fraction of those people, just 1 to 5%, will go on to develop the actual dangerous condition where their body attacks its own red blood cells. Still, it's a risk you have to watch for, and it's a big reason it's not the first choice for most patients.
So when you step back and look at the whole picture, you see this drug has this incredible double life. It's a bit too risky for everyday general use, but it's perfectly, uniquely suited for a specific and incredibly vital job.
And honestly, I think this quote just nails it. The drug has carved out a vital and enduring niche. It's not going anywhere. For this one job, there's just nothing that does it better or more safely. And that, right there, is the big lesson from Methyldopa's story. The best drug isn't always the newest one with all the bells and whistles. Sometimes it's the one that's right for the specific person in their specific situation. It's a perfect reminder that in medicine, context is absolutely everything.
And that just leaves me with one final thought to leave you with. The story of Methyldopa is such a great example of an old technology holding its ground against the new stuff. So what other old-school tech is still out there, hiding in plain sight, doing a critical job that nothing new can touch? Makes you think, doesn't it?